Good afternoon or good morning, depending on where you are, and welcome to today's webinar, Is My Nurse Turnover an Issue? Hello, I'm Tom, the Communications Lead for Eladio, and I manage our Thought Leadership webinar series, so I personally thank you all for attending today. If you also joined us for last month's presentation with Kristen Hagerman, she's a nurse informatics expert from both Advocate Healthcare and Christus Health. She addressed the role of artificial intelligence on nurse retention, so to all of you, welcome back. We planned 30 minutes for us to provide some context for our research, to review the study, and to explain how the results are driving innovation. Right now, all attendees are muted, but if you have a question, type it in the question box, and we'll address them at the end. We will record this and make this available next week, plus the report will be published on our website later in the fall. Let's begin. So who is Eladio? We're a first-of-its-kind one-stop staff relationship management platform. We've been called the Salesforce.com for nurse leaders. Essentially, a comprehensive nurse engagement solution. It's a view of what's happening on the team at both the macro and individual levels. So while we think of engagement, usually in terms of recognition that we give or maybe in a rewards program, we're pulling in data from time and attendance and HR to deliver what we call the CARES framework, which you'll hear about throughout the presentation. Basically, our data insights drive personalized observations into one of these categories. So yes, you can see celebration and, of course, recognition are included, but we analyze even deeper insights focused on accountability, risk of burnout, employee development, and staff overall issues. You'll hear about that at the conclusion today. To end this national nurse turnover issue, our mission is to facilitate 1 billion meaningful interactions using this evidence-based framework. So why are we focused on nurse turnover? Well, here's a graphic I'm sure the majority of you have seen. It's an annual update from NSI. And we're looking at about up to a 17% turnover rate nationally. And based on replacement costs, hospitals can spend between $5 and $8 million per year. So when you're reading your Becker's or your daily healthcare news feed and see that staff turnover makes the top list of priorities in healthcare year after year, this is what's at stake. Okay, so after we committed to solving the retention issue, we dove in and completed a study that included 150 hours of interviews talking to CHROs, CNOs, and CFOs from national health systems. As published in this white paper here on the left, which you can download on our website, we identified the nurse manager as being the central role in helping solve this problem. As a result, our tools are designed specifically to reduce the increasing burden on our nurse leaders, which we also learned about in that study. Then we combined that with another longitudinal study of the predictive indicators of nurse turnover. There on the right, you can see with an N of 7,700 RNs in 4 hospitals, we analyzed per fiscal quarter, then looked at whether they turned over in the following 45 to 180 days. That period was between 2010 and 18. With this study, we were able to benchmark turnover risk using aggregated data, which then were translated into those observations for the nurse manager to take action. For example, if you look here on the right, this is one data point that analyzes the likelihood of turnover when shiftmates are floating. And these are the type of insights that fuel the automation within the platform, which drives efficiency and ultimate impact. So that's a brief background about Eladio and why we believe research on this topic is so critical. But you're here for the deeper dive on retention findings, so let's get to it. I want to introduce my colleague Tim, who heads our strategy, research, and development team. This summer, he's taken a deeper look into national turnover trends, and prior to publishing, has agreed to outline the study for us today. Tim, take it away.
Yeah, thank you, Tom. This is going to be so much fun to step through, so I'm really looking forward to it, and looking forward to sharing this with everyone on the call today. So, yeah, as Tom says, we've been working with a number of hospitals over the past year or so, focusing deeply on the causes of nurse turnover, and along the way, we've learned a lot. And we've put together a few insights that I think you'll really enjoy, but more so, I really think you'll find quite a bit of it useful. And so, you know, please, as we're going through the materials, if thoughts, questions, or ideas are triggered, please put them in the questions window. I know that's hard to do all the time, and so we're, of course, always happy to talk after the presentation in any capacity. But, yeah, looking at this page, the main message here is, why do nurses leave? There's 2 reasons. There's the unchangeable reasons. It's sometimes someone gets hired as a new job into the emergency department, and it's a chaotic environment, and it's just not a good fit for them. There is sort of a demographic, unchangeable element to that. But the other part of the reason they leave are all the changeable reasons. It's the culture of the unit. It's what their manager does on a day-to-day basis. It's this CARES framework that we have down the side of the page, which is based on Leanne Rooney, and a number of other peer-reviewed publications of the last few years. In other words, for a nurse, it's so important to be celebrated and recognized, to see accountability on the floor, for their manager to be aware of the different causes and triggers of burnout and employee development, new hire check-ins, and overall issues among the staff. And so those are all the things the manager should be aware of, and it's very hard to do with a very high span of control team, as you know. But in this presentation, we're going to look at that first part. We're going to share with you some benchmarks on the parts of it that are unchangeable. So you can look at it and see and gauge, for example, if your emergency department might have a higher turnover rate than the national benchmarks might expect it to have. And I think we're going to surprise you as well by showing you some pockets of nurses that have very high turnover rates nationally that you might not be actively thinking about managing on your own team. So if you're a CNO, I hope this really helps you determine if there's different nurses and pockets of nurses and different ways to help those nurses. So we're also going to attempt to answer a very tricky but important question, which is how much of turnover is due to the unchangeable piece, in other words, just somebody's age, versus how much is due to the changeable things, the things that the nurse manager can impact. So, yeah, and as Tom mentioned, just full disclosure, we're part of the company called Eladio, and it really is our mission to help nurse managers do these 5 CARES framework items in a large team with daily data support. But in order to do that, we effectively really had to understand all of the underlying demographic drivers of turnover and the benchmarks behind that, and that's what we're about to share with you now. So, Tom, if you could move us to the next page. So as far as we know, this is a first of its kind study. You'll be among the first to see this. I'm super excited to hear what you think about it. And this is a study we'll continue to grow and develop over time as well. So we've worked with 12 hospitals over the last year. They've provided us the complete human resources record for all of their nurses, most of them going back 3 to 5 years, and that encompasses 11,266 RNs in the entire longitudinal set, and a number of certified nurse assistants as well. And we really believe this is really one of the first of its kind national study of turnover in this way. There are other studies out there, but they're always based on self-reported numbers. We've done this with the full human resources record from these hospitals. That allows us to do 2 things. One is supply a consistent definition of turnover. As we do this analysis, we've used the magnet definition. And 2, it has allowed us to slice and dice the data in unique ways to see patterns that no one has seen before. So you'll see some new things here today. Tom, if you could move us to the next page. So from our data set, this is what the average RN turnover rate looks like over the past 5 years. It was around 10, 11% in 2013, 2014, jumped up in 2015, and has remained higher than historical averages in 2015, 16, and 17. And what's interesting about this is that during the years that are shown on this page, 2014, 15, 16, we've seen a plethora of initiatives across hospitals around the country. Nurse residency programs have taken off. For example, pre-hire assessments have been implemented. Not always completely with the exclusive goal of reducing turnover, but then with the hope that those things would do, and yet we're still staying higher than historical average turnover rate, still very high turnover rate, turnover that's very costly to all hospitals around the country. The next page, Tom. While this presentation is about RNs, I do have this one page here on certified nurse assistants, and just to simply say that the pattern is the same. It's the same shape of the curve. Their turnover rate peaked in 2015 and will remain high since then. The only thing about certified nurse assistants is that their turnover rates on the whole run quite a bit higher, about 4 to 5% higher than average. But just as a point of thought, some hospitals around the country have tried deliberately hiring certified nurse assistants with the goal of seeing them through a BSN program and then taking them onto the RN role. As everyone knows, there's a bit of inherent risk in that, and this chart makes it quite clear that there's with a high risk of turnover among CNAs, what that risk is. Tom, on the next page. So as I mentioned, we work closely with these 12 hospitals with their full human resources record. This is just simply what the average turnover rate is among those 12 hospitals. And it ranges from 10 to 26%, the average being in 2017, the average around 13%. You can see that the urban centers, the trauma centers, the academic medical centers are at the bottom of this list. They tend to have lower than average turnover. The community hospitals, higher than average turnover, some of them really quite high. But the point of this page is that there's, any given hospital in the country, there is quite a range. 13% might be the current running average, but there are hospitals that are twice that we've worked with. So now to get to the good stuff. So there's a question out there that I don't know has been answered in the literature that we've ever seen, which was, is there a seasonality to turnover? And the answer is yes, a bit. June and December have spikes in turnover. So we took those 11,000 RNs, we put them into a big bucket and said, what month are they most likely to leave? The answer was June and December. Why is that? I'd actually be very curious if anyone on the webinar today has any thoughts. One reason that it could be is that there are natural breaks in the nurse's life. In June and December, kids have time off to go to school. Nurses themselves might have time off from school or to go back to school. But clearly, if you're thinking about a turnover retention program and you want to roll something out that can only be rolled out for a few weeks, doing so in November might not, October, November, and December might not be a terrible time to preempt some of the December spike. On the next page, we looked at turnover by specialty, and the variation across specialties is quite large. So here we see the average turnover rate among the hospital being about 13%, but in the emergency department, the average runs over 15%, med-surg units 15%, and the internal float pool as well 15%, quite a bit higher than the average. And then the different specialties lower than average all the way down to pediatrics and the post-anesthesia care unit down in the
Tim, can I interrupt for a second?
Yes, of course.
Yeah, Tim, this is Tom. So Patty just asked a question. She wants to know, is this the turnover leaving the organization or leaving the unit?
Yes, so that's right. So thank you for asking that. We're remiss in not saying that at the top. We're using the magnet definition of turnover for all these analyses. The magnet definition counts only those who leave the organization. So we actually, as an organization, as a group, and many of our clients think this way, if you're able to take a nurse who's in the med-surg unit for 18 months and migrate them to the emergency department within your hospital to do that successfully and that nurse stays, that is a win. It's a win for the organization. I know it's a bit of a bit, you know, it can have an effect on the med-surg unit, but it's far, far better than that nurse leaving your med-surg unit and going to somebody else's emergency department. So yes, we're counting those who leave the organization in all of these.
Tim, one more. Judith wants to know, are we including all separations or is this just voluntary? And I think you mentioned using the magnet definition. If you could give color.
Yeah, it is. It includes all separations, and you know that's an area that I'd love to do an additional work on in the future. When we get the full human resources record, how different HR departments across the country capture the information around whether it was a voluntary, involuntary, or the reason for separation varies so much, and it's just an area which is really hard to put national standards on. So it includes everybody. It includes retirements and involuntary separations. From anecdotally and from the data we've seen, the majority of these are voluntary separations, nurses choosing to leave, and they're not retirement in this 5-year period. Yeah, and I think one other, and two great questions. Thank you. And please, Tom and others, please interrupt. And just one last thought on the specialty page. I know we're covering a lot of material quite quickly here, so please, you know, ask questions as they come up. But the emergency department with the hospitals that we work with has a tremendously high span of control in most hospitals, and that's one of the reasons you see higher than average turnover here. The span of controls, a nurse manager having 150 to 220 direct reports is not uncommon in the emergency department. It's certainly one of the conditions behind this. So the question that's on our mind when we look at a page like this, which is to say, well, how much of the that higher than average turnover in the emergency department is because of just the nature of an emergency department in general? How much is due to what the manager and the culture around the team contributes? And so, Tom, if you take us to the next page, we took those 12 hospitals and we put a dot on this chart. Each of those dots is a hospital. And on the x-axis here, that's the hospital's overall turnover rate. So you see that dot on the far right side. That's a hospital that has a 26% overall turnover rate, and their emergency department has about a 26% overall turnover rate. Their emergency department is acting just like the rest of that hospital. There's something going on in that hospital, but the environment that it fits in or the culture of that hospital, but the emergency department is doing as best it can in the context of that hospital. But that dot in red, and look at that. That is an emergency department in a hospital with a very high turnover rate of 17%, but a really great, a relatively great turnover rate within the emergency department of 11%. To us, that signifies that is a manager in that emergency department who's managing the culture and the accountability, the recognition, the indicators of burnout of that team at an exemplary level. And what that means for me is any specialty in any hospital can be an exemplar, and that the avoidable nature of turnover, the avoidable factors, are actually very relevant and actionable. And just because you're in an emergency department does not mean that you have to have high turnover or higher than average turnover by any stretch, as the variation on this chart shows. Well, I know we've got a lot to cover in this half hour, and at the risk of moving too quickly, I would like to spend a bit of time on the last analysis page that we put together, and I think I find this one to be really fascinating myself, so I hope you enjoy it. So Thomas, if you take us to the heat map page. What we've got here, we took those the 11, 12,000 RNs across the country, we put them all into one big melting pot, and we slice and dice the data to say, what is the average turnover rate for those RNs within these different demographic segments? So for example, in the very top left corner, the 15% there, those are nurses who are in their 20s, between the age of 20 and 29, who less than a year of tenure in their hospital. That group nationally has a 15% average turnover rate. And so as you see on the very bottom right of the page, that's the 13% national average again. On the far right column, that's regardless of age, that category, the column that says all, that's regardless of age, what is the turnover rate for nurses within the different tenure categories? So it's 24% turnover nationally if you're in your first 12 months. And then if you make it beyond that, you get down to 18% and so on. And by the time you're at 11 to 20 years of tenure, very, very unlikely to leave. So I think that underscores things that everybody knows and suspects, that the highest turnover are among those who are newest to your organization. We also looked at age. So if you look at the very bottom row, so that would be the 15% in the bottom left and the 13%, the 12% next. That's what's your average turnover for any nurse within those age categories. And what's really interesting about this is that a couple things. Well, for me anyway, one, there's a perception that turnover is based on retiring nurses and new to practice nurses who join your hospital for 12 to 18 months and then go back to school. And yes, you see a bit of that. You see in the bottom right, the 60-plus nurses have been there for 20 years. You see a relatively high turnover rate there. Those are retiring, sure. But that's not, by any stretch, the largest number on this page. And you see that 33%, and for example, in the 40s category. Nationally, that is the highest overall pocket. It's nurses who are in their 40s. They join your hospital. They take, nationally, a national average hospital, they take one look, and they're right back out the door. And under 12 months, a third of them are. And I think it really, this is something that we've yet to run into a CNO who's really thought about it or observed it and had a detailed plan that way. And everybody really assumes that at that point, I think, you know what you're doing. You're in your 40s. You're joining a hospital. You know where things are. You have the relationships you need. And that sort of culture of checking in on them when they're at their 3-month mark, 4-month mark, bumping into them in the hall at 5 months and saying, how are you doing? Are you fitting in? Do you know where everything is? That happens a bit more for the 20-year-old nurse that joins. And but these nurses, this number screams from the page that they're looking for those same things. They're looking for new hire check-ins. They're looking for recognition. They're looking for a perception of accountability and fairness. And this page shows that that's if you're looking to reduce turnover, a great pocket to think about. So Tom, if you take us to the next page, it's the same heat map. I just put an overlay here, which is to say that 75% of all the nurses in your hospital are in that blue box there. They're within the first 5 years of their tenure. So looking at these top rows, if you're looking to reduce turnover, this is where most of the nurses are. And Tom, if you take us just to that last page with a pie chart on it, this pie chart really sort of overlays to say, okay, well, yes, but sure, the 33% turnover for my new hires who are in their 40s, but how many of those nurses are there really? And the answer is, yeah, it's quite substantial. In fact, if you look at the pie chart here, it says in your hospital, of your new hires, in a national average hospital, there are more nurses in their 30s, 40s, 50s, and 60s being hired into our average hospital today than there are nurses in their 20s. And we have a lot of these, great residency programs for nurses in their 20s and new to practice nurses. and typically far less support for these other nurses. And in fact, if you look at just nurses in their 30s and 40s added up are about as many as the nurses in their 20s, and yet you see these much higher turnover rates of those nurses. And so I think focusing on that group is one way to address your greatest areas of turnover. Really, if you're CNO looking at these different pockets and thinking about what are the different types of actions, the different types of plans, the different types of support mechanisms that we can give for nurses who are coming in at different stages of their life, at different stages of their career, and looking for similar things and different things, and how we sort of personalize that approach, especially in these areas of much higher turnover pockets. Is sort of what I hope many of the attendees here today take away. So, Tom, if there are any more questions, it'd be great to cover them, but that completes the analytics for today's call.
Great. Hey, thanks, Tim. My name is Tom Hills. I'm the third person on this call from Eladio. I'm an SVP, and I work with hospitals to address the issues that we're talking about today. As Tom DeSantis said in the introduction, our research identifies the nurse manager as the central figure in the data variation that Tim has just shown you in burnout, engagement, and culture. However, managers face a perfect storm of staff challenges, as you can see on this slide. And not only that, they're hamstrung by large spans of control. In fact, the ratio of nurse managers to direct reports can be 1 to 200 plus, making it hard to know what is going on with each nurse on each shift, and of course difficult to find time to take action. So next slide there, Tom. That's really where Eladio comes in via the CARES framework that Tom and Tim both mentioned earlier. Our research has indicated that having insights into these 5 areas that are timely and then acting on those insights in a timely manner improves culture and nurse engagement, which in turn reduces burnout and improves retention. So we move on to the next slide. It's this framework that is making an impact. As you can see in our initial study at a large tertiary care facility that's part of a larger academic health system, the difference in turnover between the Eladio cohort and the non-Eladio cohort is significant, and that equates to savings in the millions of dollars. So how does all this happen? First, Eladio frees time for nurse managers by automating work, such as attendance, outreach, and documentation. We combine and streamline workflows by bringing together data from multiple disparate systems, like time and attendance, HRIS, even paper-based systems like sticky notes and paper files. Next, nurse managers receive insights generated from this data that we're ingesting. Insights or recommended actions are prioritized based on how much they predict or are correlated with turnover. Managers can view these recommendations in each of the CARES categories on the left. In addition to presenting Eladio's recommended actions, the platform facilitates interaction, whether it's finding the nurse on the floor, sending them a text or an email, delegating interactions to collaborate with another nurse leader, or making notes to address at a later time. And managers can do all of this without leaving the platform. Finally, whether it's an action recommended by Eladio or an activity that a nurse manager decides to take from their own observations, all of the activity is tracked and measured and updated in real time. This includes views for the unit or for the individual as well. Thus, managers can stop using their sticky notes and toggling their spreadsheets and pulling up multiple data systems to find the information that they need. Instead, it's at their fingertips now, whether in this case it's Sophie, who has floated a lot last month and deserves recognition for doing so, or Ashley, who has only worked a portion of her hours during the last schedule block and needs a conversation to understand why, or Robert, who could be at risk of burnout because of all the hours he's been working recently, or take Leonora and Rosalie, who are new and need my support with 3- and 6-month check-ins to keep them on track. Focused on collaboration, Eladio also provides reporting for leadership to better understand the impact that their managers are making and the balance they are striking when it comes to meaningful interactions and building engagement. So I hope this quick overview gives you a taste of how we're working to help nurse managers be the effective leaders they always wished for when they were bedside nurses. You can go to our website and request the white papers we referenced in the beginning, or contact me directly if you want your team to see a demo of the product. As you can imagine, this was just the tip of the iceberg of what Eladio can do for you.
Thank you, Tom. Thank you, Tim. That actually brings us to the conclusion of the presentation part, but we did get a few questions that came in, and I'm going to ask those to the appropriate person on my team. Kathy wanted to know, how many observations does Eladio make? And Tom, can you take that one? Because that's kind of a loaded question.
Yeah, sure. Our analysis, and we've combined that with research from experts like Cheryl Jones, who is a professor at the University of North Carolina, have surfaced some 60 different observation types that can be measured continuously. We've vetted these observations in more than 150 hours, those hours of interviews that Tom had mentioned earlier with nurse managers across the U.S. And that being said, we analyze each client's data before we deploy, and we review the observation types that percolate from that data analysis. We compare that with what we've already ingested across all these other health systems, present that to senior leaders at each facility, and then identify the best data set to start for each hospital and system. And then the platform learns over time as it continually is interacted with by those nurse managers to keep building up our knowledge of what's really important.
Thanks, Tom. This question is from Tricia. I think, Tim, you can answer this. Did you make any assumptions, or was there any qualitative research regarding why the PACU or pediatrics, for example, might have lower turnover rates?
Yeah, that's a great question, isn't it? And I would love to hear from others on the call if they have any thoughts, if there's any observations that they've made around that. And one is, there are a couple of possible ideas. They're purely hypotheses. One is smaller span of control. There's smaller teams, and therefore the nurse managers in the PACU are just able to do the things of accountability, recognition, celebration, employee development that we've been talking about, and they can do it in a way that is much harder for a nurse manager with a 150, 200 person team. Really hard for them to do it at scale without automated support. So I think there is that. You know, maybe if you're being hypothetical, you might say the post-anesthesia care unit is quite a great place for nurses. They don't have some of the same struggles that a med surg floor might have with patients and families and all the complexities and the communication complexities, which might fit certain nurses and certain personalities. But that's, some of that's purely speculative.
Great. I have one final question. This is from Marty. I believe it's Marty. They didn't type a vowel in when they logged on. But how does the data get into Eladio? Do the managers upload it, or does IT get involved?
Yeah, I'll take that question, Tom. The system integrations are required. The good thing about it is they're common and straightforward. We provide IT on the client side with step-by-step implementation documents and pre-written scripts. And then we'll meet with system IT resources to identify the requirements. Fortunately, we found with the work that we've been doing with our clients that all of this can be completed with less than 4 to 5 hours worth of client IT resources to get it up and running. So it's not a very complex thing to get going, to get started.
Great. So I'm sure that the nurse leader or the nurse manager is relieved to hear that. They can build engagement instead of building spreadsheets. That was actually the last question we had, and so I thank you all for joining. Either one of the Toms is going to reach out with a link to the recording, so you can share this with your team or get any of the salient points that you want to get one more time. But with that being said, it takes us down to about a half an hour, and we thank everybody for joining us, and have a great rest of your day.
Thank you.
Thank you.